YouTubers. This is Arnold Solof back for another COVID-19 update for March 27th, 2020. This update will focus on why I believe that the granular approach will not work. Now, the granular approach is being considered because of the effect of the pandemic on our economy, and the thought is that if there are certain areas that are not that affected, they don't need the same restrictions that the rest of the country that's more affected needs. Well, the problem with that is to have a granular approach, you need to be able to detect the infection. To detect the infection, you need to have test kits. In the United States, despite what we are being told at the coronavirus briefings, we have a severe shortage of test kits. Now, just to illustrate how severe that is, the United States currently has more cases of this infection than any other country in the world. I live in New Jersey, which has the second highest number of cases in the country, more than any other state except for New York. I'm a physician in New Jersey. I cannot order the test on my patients. Still, as of this day, I have LabCorp and Quest, which supposedly offered the test 2 weeks ago. We requested the sampling kits, and we can't get them. So we cannot order them from Quest or LabCorp. We do have one lab that we can get the test kits from, and we have them in our office. The lab is called Diatherix. But we are instructed by the state and the federal government, don't use the tests because we have such a shortage, we have to save them for very specific high-risk groups, such as the very elderly, immune-compromised, healthcare workers, etc. So when my patients come in with their fever, their cough, respiratory symptoms consistent with COVID-19, I can't test them. And I'm in the state in the country that has the highest number of cases in the world, in the state that has the second most number of cases of any state in the country, and I can't do the test on my patients. So, if we can't do the test, we don't know who the people are. Not only can I not get the regular test, the test that tests for active infection, the RT-PCR test, I can't do the antibody test either, which would determine whether there's been past infection and immunity. So, if I don't have this information, and let's say I'm in the public health service, and I'm trying to say, okay, let's not be unnecessarily restrictive. Well, if I could tell who the infected people were, trace their contacts, and have control of that situation, that would be great. And then the granular approach would work perfectly, and we would be able to be much less restrictive in our closings of businesses, etc. But we don't have the tests, so we are still blind. And you can't have a granular approach if you can't do contact tracing, and you can't do contact tracing if you don't have tests. So this is where we are. This is why we shouldn't be talking about the granular approach yet. Yes, we should when we get the tests, but we still don't have the tests. At least the tests in sufficient quantities to allow us to do this effectively. So again, this is the point I wanted to make today. I think, I don't know. I don't know what's going on up at the top here. I don't know if the people in CDC are misleading the president, or whether the president is because he wants to be able to not close down the more of the country than is necessary, is pushing the people at the top of the public health bureaus to try to figure out how to implement his wishes, and they're moving in this direction. Who knows? But regardless of where it's coming from, it won't work until we can see who's got it, and we can't see who's got it until we can test. So that's it for today. I know this is not very comforting to hear, but this is where we are. And this is why, we have so many cases, and why it's going to get a whole lot worse before it gets better. I went back to my spreadsheet. If you look at my prior video called Running the Numbers, we're still on target from those projections. We're doubling about every 3 days the number of new cases. We're 13 doublings away before this goes through the whole country. And that would put us to mid-May. And if we allow people to continue to commingle, then the virus will continue to double at an unrestricted rate, which is doubling every 2 to 3 days. And it will continue to do that. Now, why you wouldn't want to have the entire country shelter in place until you have enough test kits so that you can do proper contact tracing, it doesn't make sense to me. So my recommendation is the whole country be in shelter in place until we have the test kits available so that we can do proper contact tracing. Well, that's it for today. Thanks for watching.